It is a busy morning, and let's start with President Trump and the director of the CDC, who appear to be at odds over the timing of a potential coronavirus vaccine and the importance of wearing masks. The director of the Centers for Disease Control, Dr. Robert Redfield, said in a Senate hearing yesterday a vaccine will not be widely distributed until spring or summer of next year.
I think there will be vaccine that initially be available sometime between November and December, but very limited supply and will have to be prioritized. If you're asking me when is it going to be generally available to the American public so we can begin to take advantage of vaccine to get back to our regular life, I think we're probably looking at late second quarter, third quarter, 2021.
I think he made a mistake when he said that. It's just incorrect information. And I called him, and he didn't tell me that, and I think he got the message, maybe confused, maybe it was stated incorrectly. No, we're ready to go immediately as the vaccine is announced, and it could be announced in October.
And then to the question of masks at the Senate hearing yesterday. Dr. Redfield also came out in strong support of wearing masks to combat coronavirus.
Face masks, these face masks are the most important, powerful public health tool we have. And I will continue to appeal for all Americans, all individuals in our country, to embrace these face coverings. I've said it, if we did it for 6, 8, 10, 12 weeks, we'd bring this pandemic under control. These actually, we have clear scientific evidence, they work, and they are our best defense. I might even go so far as to say that this face mask is more guaranteed to protect me against COVID than when I take a COVID vaccine.
Number one, it's not more effective by any means than a vaccine, and I called him about that. Those were the two things I discussed with him. And I believe that if you ask him, he would probably say that he didn't understand the question. But when I called up Robert today, I said to him, what's with the mask? He said, I think I answered that question incorrectly. I think maybe he misunderstood it. I mean, you know, you have two questions. Maybe he misunderstood both of them. But the answer to the one is it's going to be a much faster distribution than he said. Maybe he's not aware of the distribution process. It's not really his thing as much as it would be, let's say, mine. But the distribution is going to be much faster. As far as the mask is concerned, I hope that the vaccine is going to be a lot more beneficial than the masks.
So President Trump says Dr. Redfield, the head of the CDC, was, quote, confused. Afterwards, Redfield tweeted this, quote, I 100% believe in the importance of vaccines and the importance, in particular, of a COVID-19 vaccine. A COVID-19 vaccine is the thing that will get Americans back to normal everyday life. The best defense we currently have against this virus are the important mitigation efforts of wearing a mask, washing your hands, social distancing, and being careful about crowds. Jonathan Lemire, you were there in the room yesterday at that briefing with President Trump, asked a couple of questions on masks and about these contradictions. He says the head of the CDC, a leading infectious disease expert, was, quote, confused by those two questions. He didn't look confused if you watch the tape, gave pretty clear answers to both questions. How did this play out afterward? You have some new reporting about what went on after the president left that stage.
That's right, Willie, and certainly we could safely say this. We've never been here before in terms of a president so frequently and publicly and consistently contradicting the medical experts and health professionals and the public health experts on his own staff, including here the director of the CDC, who, yes, as you say, did not really appear confused in his testimony yesterday, where he offered a timeline on a vaccine and messaging on masks that simply doesn't square with what the president has been saying day in, day out, and particularly what he is hoping happens for his reelection bid. From the podium yesterday in the White House briefing room, the president said, and he was backed up by Dr. Scott Atlas, his new favored member of the medical team, who was sitting there off to the side, that they thought that a vaccine would be available to first responders, to emergency workers, to the ones who need it most in a limited capacity by year's end. And the president really was leaning hard into the idea of October in early November, which of course would fall just before the election. And we know his advisors really want that to happen, thinking that could be his October surprise. And then I asked him about masks and said, well, look, if indeed the CDC director thinks that masks are as or even more important than a vaccine, why not, considering the resources you put into developing developing a vaccine, why not devote similar energy into promoting mask usage, even if it's simply a matter of you and members of the White House staff wearing them, even though you, of course, are tested every day, to promote their use. And he also said that that was not something he agreed with. And this leads us to this question. Does he truly have confidence in the CDC director? We heard him say afterwards give a sort of lukewarm endorsement. The CDC director clearly decided to try to clean up those comments rather than trying to perhaps resign out of protest. We'll be interested to see how that relationship plays out in the coming days. And then, yes, in the moments after the briefing concluded, the president retreated to the White House press office, which is just steps off of the briefing room, to watch the coverage of what had just transpired. He and a couple senior aides were watching how it was playing out on Fox News. And according to a person who overheard the exchange, the president sort of turned to the group of aides with him, watched how he rebuked and undermined Redfield, and simply said, I did the best I could in terms of trying to change the messaging of the moment, which, of course, though, seems to, yet again, fly in the face of science.
I mean, first of all, pull back. Two big things here, Jonathan Lemire. Obviously, he wants that vaccine within the election period, and he wants to be able to announce it. But there was even disagreement in the room as to when that vaccine would be available and who it would be available to. Was it first responders? Was it people who most needed it? Was it the general public? And that would change from October to November to Q1 to March. It was a push to try and get some sort of vaccine announcement as soon as possible. Who cares who it's really for? Who cares what the truth is? The president just wants what he wants, whether or not it actually is a fact, something we've seen before, a pattern of his presidency.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.